actually the voodoo doll. How does it look with the marble beads?
Yeah,
Like
yeah,
that?
that's good.
Enough of that. Thank you. Just FYI, after my talk here today with you, I'm heading out to Annapolis. We are doing our 2013 bill hearing, both in the Senate and the House. So if anyone is interested in a road trip, I think you get a lot of good information about kind of what's being legislated in 2013 in Maryland around the Affordable Care Act and exchanges in particular. So, as David and Marta mentioned, the Affordable Care Act is a huge sweeping change, as I'm sure you're all aware. And we could spend a whole week talking about the different elements of the Affordable Care Act. For today, I'm going to really focus on the impact to small businesses and the Small Business Exchange, which Maryland Health Benefit Exchange or Maryland Health Connection is establishing and looking to put into operations towards the end of this year, October for the first open enrollment period, and January for the first effective coverage date for plans. So I know Marta asked how many of you all were self-insured, and only a couple of hands came up. So I'm going to assume that the vast majority here buy fully insured plans. Is that accurate? Okay, great. And how many of you would consider yourselves a small business, under 50 employees, just by show of hands? Okay. And how many of you understand sort of the accounting rules to determine whether you're really a small business, whether you qualify for an exchange or potentially a tax credit or a tax penalty? A couple of people maybe understand that. All right, so hopefully we can shed some light on that. We very much are a startup small business ourselves. We're not a long-established state agency. In fact, we were established by law in 2011 as a quasi-governmental agency, and we have, I think we're up to about 12 employees right now, and we're looking to grow to about 60 or so by the end of the year. So a lot of the work that we're doing right now in preparation for rolling out the exchange and the pieces of the Affordable Care Act that we're responsible for, we're relying on a lot of state agency partners and vendor partners, especially, on the technology side. But, as a small business, and many of you know, that you often have to, wear many hats. So in addition to being the Chief Information Officer, I'm also the de facto shop director, having had some experience in that realm with my tenure at Care First. So a lot of what I do, in addition to working on the IT policies and implementation, is also work with partners around the state in developing our small business policies as they pertain to what's discretionary in Maryland and what's going to be implemented on the exchange. Maryland is well recognized as one of the leaders from a state perspective in implementing the Affordable Care Act and the exchange, and obviously our proximity to DC allows us great access to folks at CMS and HHS, so a lot of the rule makers for how these markets are going to operate come 2014. Okay, so let's go into this, and I want this, if we can, to make it somewhat interactive. So I'll throw out questions to the group, and if anyone has a question for me, please feel free to raise your hand, and we can take that question then, or if you want, we can save it to the end. I see some of you flipping through the handouts. That's not my presentation. I can definitely make my presentation available to you all. The handouts are really something that we put together for small businesses to give some of the basics about the exchange and the Affordable Care Act. One of the things that the ACA allowed for was giving each state the opportunity to establish its own state-based exchange or default to the federal exchange, and there's different versions of the federal exchange, including a full service exchange operated by the federal government and a partnership exchange. But Maryland, as I mentioned, is embracing the Affordable Care Act. We are going to establish our own exchange, and what that really is a new marketplace to connect individuals and small businesses to affordable health care coverage. So one of the key things that we'll be setting up is an online website that allows individuals and small businesses to go online, learn about the plan options available for them, do comparison shopping. For employers, it'll provide different options for setting up what plans you want your employees to have access to and how you want to set your defined contribution. Additionally, the only way that businesses, small businesses, can take advantage of those tax credits that are available to them is through the purchase of qualified health plans on the exchange. What the exchange is not is a state-based product. So we are not offering our own insurance product and administering it. We're really a marketplace to connect you all to private insurance options. And we are working very closely, with all the carriers in the state right now to make sure that they have products available on the exchange. Additionally, the Affordable Care Act opens the door to many other market players. So we might actually see an expansion of choices here in Maryland for small business as it pertains to small business healthcare options. Okay, so as I mentioned, the Health Benefit Exchange Act of 2011 established the exchange as a public corporation and an independent unit of state government. We do have a 9-member board of trustees that was appointed in 2011, and an executive director who also started in 2011. I think I was employee number 2 back in December of 2011. I think the past 2 years have been very busy for us in terms of outreach to industry, to businesses, to consumers. In 2011, we established several stakeholder advisory committees to advise the exchange on different aspects of the Affordable Care Act and how we wanted to shape this new online marketplace. So some of the areas that we created committees around were navigator and consumer assistance, market rules, an operating model, the shop, and the financing of the exchange. So the federal government is providing grant dollars to each state that is establishing their own exchange for basically the setup functions, but each state's exchange has to become self-sustaining come 2015. So that's what that last committee is about. And actually, when I was with Care First Blue Cross Blue Shield, I was actually Care First representative to the Market Rules and Risk Selection Committee. Let's see. In terms of representation, at these committees, we had a lot of input and participation from health insurers, from providers, community members, advocates, community-based organizations, business owners, local chamber officials, consumers, and consultants. In Maryland, we do have although a small population, we do have a pretty significant population that is uninsured. Marta threw out the statistic for Montgomery County. I think across the state, it's much larger, into the hundreds of thousands. And a lot of those folks, have never had health insurance before, or many of them have been on public assistance programs like Medicaid. So connecting those folks, folks who maybe are inner city, rural areas, who, English as a second language, a lot of those folks who haven't had access to care, we're really focusing on bringing them into the fold and getting them into the insurance pool. And that's really what the Navigator program is about. So it's not, a lot of people have thought that as a replacement to brokers, and that's really not the case. We see the Navigator serving a different function altogether, and then also working very closely with brokers. I'm assuming most of you have a relationship with a broker or a third-party benefit administrator, just by show of hands. Yeah. So that's pretty typical. Okay, let's see. I'm going to move us along a little.